I'm a nurse. Let me just do some hand hygiene. I will be taking care of you. I'm here to do a head-to-toe assessment. Is that all right? Won't take more than 20 minutes. If you can lay back, can I ask you for your name and your date of birth?
Alana Prinz, May 15, 2001.
Awesome. Can I check your wristband? Great, that checks out. And can you tell me what month it is?
November.
Awesome. And where you are?
Loyola.
Awesome. So I just checked her alertness and orientation, which is AO +4, indicates she's alert and oriented. Do you have any allergies?
No.
No. Okay. If you did, I would ask you for any reactions that you had, but since you don't have any, that's awesome. And are you in any pain?
No.
Awesome. If she was in pain, I would ask her to rate her pain on a scale of 0 to 10, 0 being no pain to 10 being excruciating, and then I would also use old cards questions to be more informed about pain. So as she came in, I was able to assess her mobility and her gait. She had great balance. Nothing was wrong. No slouching as she walked in. Great posture. She didn't lug her body in here. She has great personal hygiene, I can tell. She has washed her hair. She's taking care of herself. She is dressed appropriately for the weather. It's getting cold. She's wearing pants, and she wore a coat as she came in. Can you let me know your height and your weight?
I'm 5'7", and I weigh 130 pounds.
Awesome. So she is in range for BMI, meaning you're not overweight or underweight. You're in perfect normal range. And I can tell as I ask her the questions, she doesn't have any slurred speech or any difficulties with her speech or any stuttering. Her skin color, just from appearance currently, looks great. No redness, no blue, yellow. Skin looks nice and fair. And can you smile for me? She's doing an angry face. She's great facial expressions, which is awesome. And now we will move on to the assessment, if that's okay.
Yeah.
Awesome. So I will be starting with your head and your scalp, checking your hair, checking your scalp and head for any lesions or bumps, bruises, anything that's out of the ordinary, which I don't seem to find. No redness. Is your scalp itchy?
No.
Perfect. Her hair is nice and healthy, which I can tell from the smoothness and shininess. It's thick and it's dark brown. Can I just feel your head? It's normocephalic. You can put your head back, which is a great shape of the head. And her facial features are all symmetrical. Her eyes line up with her eyebrows. Her eyebrows are nice and full. Her nose lies midline of her face, as well as her cupid's bow of her lip, and her lips are nice and pink, and in the center of her face as well. Now, I will inspect your ears, if you don't mind checking your head. Her ears seem to have a good color, no lesions or bleeding, no tattoos pierced on both ears. Awesome, and now I will just be checking internally. Awesome, no bleeding, no drainage. She does have earwax. Do you clean your ears?
Yeah.
Awesome, how do you clean your ears?
I take Q-tip after the shower.
Awesome, do you make sure you don't go too deep?
Yeah, I don't.
Awesome, because that can damage your ears. Your ears look great. Do you have any hearing problems or hearing loss?
No, I do not.
Awesome. And now we will move on to your eyes. I can tell that you wear glasses, so are you farsighted or nearsighted?
I'm nearsighted.
Awesome. Do you also wear contacts by any chance?
Yes, I do.
Okay. Do you make sure you go on a yearly checkup to update your prescription?
Yes, I do.
Awesome. And do you take care of your contacts, take care of your eyes, and make sure you take them out?
Yes.
And clean them?
Yes.
Awesome. Okay, take off your glasses for me. I'm just gonna palpate your eyelids. No bumps, nice and smooth. Her conjunctiva is nice and pink and moist, which is awesome. I'm gonna have you close one eye. Awesome, close the other eye. And move the other hand. Awesome. Her eyes show perla, meaning her pupils are round, reacting equally and accommodating to light. I'm going to have you look at my pen, follow the end of my pen. Awesome, her EOM seems to be in check. And one more, I'm just going to have you follow the end, top part of my pen. Awesome, she's able to cross her eyes. Next, her blinking is effortless, and there's no shakiness of the eyes, or there seems to be no dryness. And now we will be moving on to the nose. Externally, her nose looks great, midline of her face, no curving or bending in the middle. It's proportional to the other facial features, there's no lesions, and now checking externally through her nares. It's nice and moist. She does not have a deviated septum, meaning assuming that she can breathe well, but just to make sure, we will check for patency. Can you cover one nostril, breathe in and out, check the other one. Awesome, there also seems to be no drainage, which is also awesome. And then I will be checking your mouth and throat. Her lips are nice and pink, not dry, not cracked, which indicates hydration, that she takes care of them. And there's no lesions in the alignment. Next up, can you smile for me again? Awesome. And can you stick out your tongue and open wide? Her uvula, her pink, and her pharynx, her soft and hard plate look nice, healthy, and moist. Great, awesome bright pink color. Lift the top part of your tongue. Under her tongue looks great. Her teeth look all good. Doesn't seem like she has any cavities, but she has to go to the dentist just to make sure. No cracks, no lesions. Her tongue looks great, and no lesions in her cheeks, which are her buccal area. And she also has no odor, meaning she is up to date and takes well of her dental hygiene well. And now I will just be checking your neck for your lymph nodes and your thyroid, making sure everything isn't swollen, which it doesn't seem to be. And can you tilt your head forward, tilt it back, tilt one to the other shoulder. Awesome, her neck has great range of motion. You can lay back down. And just for skin appearance, can you put your arm out, please? Actually, I'm just gonna have you sit down. Checking the temperature of her skin. She's warm to the touch, using the back of my hand. And her turgor, skin bounces back, meaning she's hydrated. There appear to be no lesions or odd pigmentations, no rashes, no abnormal moles, and the color matches the rest of her body. I will be checking your nails if you don't mind. They are nice, smooth and shiny. They are growing. Her nail buds look great. I'm just going to check your capillary refill, which seems to be filling back up in under 2 seconds, which indicate awesome oxidation. Awesome. And I'm going to have you push back on my hands. Awesome. Go like this and pull. She's great muscular strength in her upper extremities. And can you flex your wrists, point them down, circles, other circles, open your fingers, close them, open. Awesome. She has great range of motion in her joints and her wrists and her elbows. Can you bend your elbows? Awesome. And her fingers. Next we will do is respiratory system, so I will be inspecting, if you don't mind. You can actually, come over here and kind of turn face me. We'll be inspecting anterior, posterior, the 14 points, 6 in the front, 6 in the back, and 2 lateral. Actually, can you turn for me forward here so you can see? We're going to do the bronchial, bronchiovascular, and then the vascular. Okay, The bronchial were nice and loud, hard, high-pitched noises. The bronchiovascular wasn't as loud or high-pitched, and then the lower vascular were lower pitched, which indicates great healthy breathing, no crackling, which is awesome. Can you just take a big deep breath for me right now? Her chest seems to move up and down accordingly without labored breathing, effortlessly. Turn back this way now. Now I'll just be checking posteriorly, going from left to right, down, and so on. Take a deep breath. Slower. Thank you. In. Again. And one more. Awesome. I'm just going to check laterally. And again, her breath sounds, you can face front, seem to be awesome and great and healthy, and nothing to worry about, no crackling, no screeching, and no mucus. So next we will be doing is
That's on.
okay. Next will be the cardiovascular, and I will be taking your carotid pulse. About a pulse of 2+, which is great circulation. And now I will be auscultating the 5 listening points of the heart. The first being aortic, and the second intercostal space on the right, off to the sternal border, and then it goes pulmonic, second intercostal on the left, off of the sternal border, then keep going down the sternal border. The third intercostal space would be the ERB. Tricuspid would be the fourth intercostal space on the left, and then mitral would be the fifth, not technically off of the sternal border. So, do that. I'm going to start. This is a tricuspid. And then the mitral, for which we will listen to for a whole minute because it is the PMI. And I got 78 beats per minute, which is in the normal beats per minute range, which is awesome. She had a great pulse, no murmurs, and no skips, which is also great. And then next we'll move to the gastrointestinal. So if you can just scooch down a little bit. I will be inspecting her abdomen. If she'd be normally wearing a dress, I'd pull it up and cover the lower part for privacy with a blanket. Inspecting, everything's asymmetrical. Her belly button is in the midline. The pigmentation of her body, abdomen correlates with the rest of her skin. For color, there are no lesions, there are no bumps, and I will be auscultating in each quadrant, starting with the right lower quadrant to listen for any bowel movement sounds. bowel movement sounds, probably because she ate a while ago. And when did you last eat?
4 hours.
Perfect, so that makes sense. When was your last bowel movement?
3 hours.
Awesome. And when was your last menstrual cycle?
Started 4 days ago.
Okay, so that's all good, all in check. And now I will be palpating just to see if there's any distension or guarding, which there shouldn't be, and to see if there's any pain. Are you feeling any pain?
No.
Awesome. I will also be watching her face to see if she will be grimacing or making any faces that show or indicate that she is in pain, which it doesn't seem like she is, which is great. You can pull your shirt down. I would pull her dress down, pull about just halfway probably to inspect her lower extremities now. Inspecting, they are temperature-wise warm to the touch, which is awesome. They're nice, smooth, and shiny. Do you shave?
Yes.
Awesome. That indicate, but I can tell that there's hair growth, which indicates vascularity. There aren't any odd moles or pigmentation, no lesions. I will now be taking the Orthopedias pulse on both feet. Awesome. They are both bounding 2+ bilaterally, and then if you can swing around and sit on the edge. If we will be checking motion and the muscles, so if you can straighten, awesome, and put down, flex your ankles, point, circles, other circles, awesome, look at your toes. Do you feel this?
Yes.
Awesome. So that just goes to show that she has range of motion in her knees, her joints, her knees, and her ankles. And can you pull? Awesome, and then push. Great, and you can tell that her muscles are in check for her lower extremities. You can lay back down, move the bed to 45 degrees. For the head of the bed, put the rail guard up, make sure that they are both up. Let her know that the call button is right here. If you need anything, just press it, don't be afraid. The doctor will be with you shortly. I will be gone, and I will come back with no later than half an hour. Do you need anything?
No, thank you.
Awesome. Are you comfortable?
Yes.
Okie dokie. Don't hesitate to press the call light, and I'll let you go and do my last personal hygiene.
Thank you.